I'm Dr. Ambarish Pandey. I'm a cardiologist at Southwestern Medical Center, and my research focus is preventive cardiology and identifying novel approaches to prevent heart failure in high-risk individuals such as those with diabetes and obesity. Yeah, so there has been a controversy over whether SGLT2 inhibitors have high efficacy in patients who have heart failure and ejection fraction over 60%. And the VERTIS CV trial was done using ertugliflozin as the SGLT2 inhibitor in patients with type 2 diabetes and atherosclerotic cardiovascular disease, 24% of whom had history of heart failure. Now, in VERTIS trial itself, ertugliflozin was associated with a lower risk of heart failure hospitalization. And in participants with heart failure, the risk reduction did not differ between those with a reduced ejection fraction versus preserved ejection fraction. If you look at the ejection fraction much further beyond 45% up to as far as higher than 60%, whether or not ertugliflozin was associated with consistent reduction in risk across the spectrum of pretrial ejection fraction, particularly among those who had ejection fraction more than 60%, is not well established. And hence we conducted the study to look at the efficacy of ertugliflozin across the spectrum of ejection fraction. So the patient population were participants of the VERTIS trial, which was a multi-center randomized, double-blind, placebo-controlled, event-driven phase 3 cardiovascular outcomes trial. Participants were aged 40 years or older, had a history of type 2 diabetes, and established atherosclerotic cardiovascular disease. And they were randomized to getting ertugliflozin at doses of 5 or 15 milligrams and or placebo. And the follow-up was for 3.5 years. And the two ertugliflozin groups were combined for all the analysis, and comparison was made to the placebo. So the key findings that we noted was that there was no interaction between pretrial ejection fraction and the treatment of ertugliflozin for the risk of first heart failure hospitalization event. So the magnitude of benefit that was seen in the overall trial population was 30% reduction in risk. And if you look at the EF subgroup of more than 60% before trial enrollment, the risk reduction was around 28%. So kind of having a comparable improvement in risk of heart failure hospitalization with ertugliflozin use across the EF spectrum without a significant effect modification. That was the main finding. I think it's important to better understand the mechanisms through which SGLT2 inhibitors are able to reduce risk of heart failure hospitalization in these patients. And it's also important to look at implementation strategies that can promote use of ertugliflozin and similar SGLT2 inhibitors that are now available for prevention of heart failure among patients with diabetes.